All right, we're
For
gonna
sure.
move on. We're gonna move on to our next topic. Um, the headline goes: The doctor failed me. Detransitioned woman who had her breasts and uterus removed when she thought she was a man during mental health crisis sues 8 healthcare workers who helped her change. Michelle, who's 34 years old, has filed a lawsuit against the 8 doctors and mental health professionals who prescribed her testosterone treatments and gave her a bilateral mastectomy and hysterectomy. Um, for those who don't know, and I think I might be confusing the two, but mastectomy is the removal of one or both of the breasts, and a hysterectomy is the removal of the uterus. I might have mixed up those two words, but that's what one of them or both of them mean. So she's claiming that she released like a video I think on GoFundMe because she was trying to raise funds for the lawsuit, and she claims that her long-standing history with mental health struggles should have been a signpost for medical carers to challenge her decision to of wanting to transition. So
Can't challenge anything nowadays.
the idea was that um well, I'll give her timeline. And so she says, let me just add. So by them not challenging her or by them not like asking more questions and sort of like drilling into her as to why she's wanting to change, by not doing so, therefore, she alleges that the lack of inquiry is a failure of due diligence amounting to medical negligence towards a vulnerable patient. So her timeline is as follows. So Michelle in 2008 starts to see a therapist after a self transition attempt, um, suicide attempt. 2009, Michelle says she started thinking about her gender critically. So she's around 21 years old at this point, and she questioned her gender after reading about gender identity on Tumblr. I don't know if you guys
And
remember
when
Tumblr.
you say she, oh yeah, I remember Tumblr.
She's a
Mm-hmm.
woman. She's a woman. She's a woman. She's a woman.
She was born as a woman.
She
She
was
was born as a female.
she was born as a female, and then she had like an identity crisis. Well, not let me. So at some point, she wanted to transition into a man because she thought that that was her gender, and
Hmm.
then she's now detransitioned, so she's reverted back to being a woman. So in 2000, so in 2008 she started to see a therapist regularly after a suicide attempt. And so in 2010, Zakinga attends a Toronto support group where another therapist puts her forward or recommends for her hormone therapy after just one appointment lasting less than an hour. So all of this is from her account, by the way. So mental health professionals who Zakinga is seeing following a 2008 suicide attempt reportedly say she is an ideal candidate for hormone therapy. In 2012, different professionals had referred her for a bilateral mastectomy, removing her breast. And in 2016, she stops taking testosterone at this point, and no, she stops taking the testosterone and and starts to identify as non-binary. And in 2017, she is referred for a full psychological assessment where she is diagnosed with autism, ADHD, MDD, and traits of PTSD. And then another professional referred her for a hysterectomy, so that's the removal of the uterus, to remove her uterus, which is completed in May 2018. And then in 2020, Zakinga says she reflects on her diagnosis and decided to detransition. Initial thoughts?
No, I just think it's yeah, I agree
I
with.
think it's crazy. You can't have all doctors, well, not all doctors. You can't have certain doctors knowing everything about what you want, right? You can't go to a dentist and say my vision is not great. Right? You can't go to a dentist. You say my teeth is hurting me, and then you come back. You say, oh, but my eyes was also hurting me. Why didn't you check it? Like you can't expect
Well,
you can't expect a guy who's helping you transition to also know about your mental state,
mm,
right?
that's
Especially if
true.
you're showing signs of normal activities.
But that's true. Whilst the analogy you're giving is true, it's also not true for her because she first went to a therapist, and then her therapist and every other psychologist. So these are people who are experts of the mind.
Hmm.
All had conversations with her, and one of them had a conversation with her for less than an hour, even. Sort of said all of them had a conversation with her and said you should go on to hormonal therapy. You're an ideal candidate for hormonal therapy. Sort of almost sort of saying, I think you should transition, essentially.
Okay, in that case, then I think they should be sued. Yeah, because
Yeah.
they're not supposed to advise, basically their clients. They're supposed to, like, take in what they say and then, just listen, basically.
Yeah, her
Like,
all
at
her,
least from what I understand,
Yeah.
is you're not meant to be giving them advice because that's not the job of the therapist. It's the job to basically listen and then ask questions, which will then open up maybe thoughts of the client.
the idea was that the her entire sort of like lawsuit is based upon the fact that they never really explored her history of mental illness or s-
Yeah.
or history of yeah, mental illness. We're just gonna call it that. I think she used another word. Her mental health struggles. We'll just use that, not mental illness. So they never really explored her mental health struggles that she's had beforehand, and as she claims that she never, prior to being with that therapist, she never really had any thoughts of body dysphoria or anything like this. So body dysphoria, I think, is the like having sort of ill feelings towards how your body looks, but on a professional level, like the difference between like depression and clinical depression. Um, so it's more than just being insecure. It's like actually like hating how your body looks. So she says that she never really had that prior to in her childhood. She only just really struggled with just she just had like other mental health struggles.
Just remind me real quick, is it only the like therapists and those are getting sued, or is it like the
So
ones
it's
also who
8
performed the
people. It's
operations?
8. They don't really go into. I think they did, but I never I didn't see it. But it was she's suing healthcare workers, um, and so doctors and mental health professionals. I don't know if she's suing the like the doctors who performed the surgery, but maybe like
Yeah, 'cause
doctors as in psychologists, like MB.
okay, so yeah, okay, I stand by what I said then. Because if it's the ones who like perform the operation, I completely disagree with that. But
Yeah,
if it's
probably
like the mental health workers and stuff, then yeah, for sure.
the PhD doctors. I don't think she's talking about
Yeah.
the MD doctors.
Mm.
Masen, any thoughts on that?
Oh, I don't know. This is one of those situations.
Well,
Like right now, there's no rule book.
what do you
There,
think? First and foremost, do you think she has a legitimate case? Like, do you think she has a case to
I
stand
think
on?
she actually might have a legitimate case.
Okay, go on.
Yeah. Yeah. But there's no rules. There's no rule book now. I think she probably would have had a legitimate case to sue both ways. If they said no, she probably would have had the right then to sue, and she may have won. With the
The climate of the
with
world.
with the climate of the world, with what's going
Mm,
on right now.
mm.
And she may have won, and now she still has a legitimate case because there are no rules. Like this is something water.
Yeah, I know what you're talking about though. Yeah.
Yeah,
Unregulated.
yeah. There's another word I think I was looking for, but we'll go with unregulated water. This is Like we don't know the rules. We don't know what's going on, and rules are being kind of created on the spot. Like now, whatever happens now for this case is going to probably determine a lot of other cases in the future. This may
Yeah,
even be studied like in a law school for a lot of
yeah.
people.
Well, to be fair,
Um,
it's a yeah, it's a unique case. It is a unique case. I don't think I've ever seen a case like this before. Although the idea behind lack of due diligence amounting to medical negligence to a vulnerable patient, I don't think that's unique. That might have happened before. It's just not in these case, not in this specific circumstance of
yeah,
a person transitioning and then detransitioning.
I wonder if it's happened
Other
to
people
people
must
in
have.
relation, but I'm thinking in relation to like plastic surgery. Like if somebody had a um, what, what did they say? Mental challenges, was that their
Mental
wording?
health struggles.
Mental health struggles. So if somebody had mental health struggles, we'll use the same wording, and they had gone and got plastic surgery, would it
Mm,
be the same thing? Like their nose, they had a nose, they call it a nose job.
yeah, and then it was performed.
Yeah,
Well,
it was, and yeah,
I
perhaps
mean, I'd assume something irreversible, then it could be considered
that's true.
on the
It's
same
because,
level.
but the thing is too is that the idea is that the medical negligence comes from the lack of diligence comes from the fact that she had spoken to so many professionals prior to
yeah,
actually getting her surgeries done, and they all sort of just went, okay, yeah, I see how you feel, and we should move forward with that, rather than sort of at least in her argument going, well, let's explore more, let's understand your history more, let's see, blah 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 blah. They sort of just went in her argument. They sort of just went, okay, like I see it feels a lot like you're a prime candidate for um hormonal therapy, and they sort of just went, cool, let's just do that. And she kind of just followed along with it because she had an identity crisis, I suppose, a gender identity crisis at that point in her life.
mm,
And then again, the other part of it too is that she, you know, she came off of just this all happened like just a few years after her suicide attempt. So you have to assume that mentally she's still sort of like she was probably still in a vulnerable spot.
mm.
Um, and so
But
her entire argument is just that more should have been done in regards to exploring her history, especially coming
did,
Yeah.
off of a suicide attempt.
yeah, have you guys heard of the psychologists that were sued? I don't know if it was psychologists or counselors. They were sued because they were, I don't remember the exact story, but it was basically the opposite, where they didn't support it necessarily. They were like, look, let's talk about it. This may not be what you want to do. Um, and they were sued for that because they didn't, they were saying maybe this is just something you're dealing with right now. Maybe it's because of your mental health. That was my understanding of it.
Yeah,
Another situation as well. I think this was in Canada. It was
this
a
was in Canada
young,
too, by the way. Sorry, carry
interesting. It was a young, I say young lady. I think she was like 13 or 14, and she wanted to transition.
on.
And she tried to transition, and her dad stopped her and said
Mm,
she's too young.
mm,
And he was sued because of that. And I think he actually went to prison because he was trying to stop her from transitioning. And that
Yeah.
was seen as, not allowing her to be open, blah, blah, blah. But now you're having this situation, which sounds like a legitimate case, but she's doing the exact opposite, which
yeah.
is
That's very
uh,
interesting.
It
Yeah.
is. I'll be honest with you. Dunya's gone crazy. I don't know what else to tell you outside of like that. Dunya's gone crazy.